This is Kenya News Update today. What if I told you Canada just declared America's health system untrustworthy? In the next 4 minutes, you'll discover why vaccines are at the center of a shocking international rift and what this means for global health. Meet Health Minister Marjorie Michel. She's Canada's top health official. For decades, Canada looked to the US for scientific guidance, but in a year-end interview, she dropped a bombshell. I cannot trust them as a reliable partner. Those 7 words signal a seismic shift, but here's the twist. This isn't about politics, it's about vaccines, and it's happening right now. The US Secretary of Health and Human Services is Robert F. Kennedy Jr., an anti-vaccine activist. Under his watch, the CDC's website was changed in late November. The change, to contradict the scientific consensus that vaccines don't cause autism. Former CDC officials are sounding the alarm. They say information about vaccine safety can no longer be trusted, but here's what nobody's talking about. An advisory panel chosen by Kennedy recently recommended ending routine hepatitis B vaccines for newborns. They're considering changes to the entire childhood vaccine schedule. And then, something shocking happened. The Trump administration slashed budgets. The CDC, the National Institutes of Health, even research into the effects of misinformation was cut. Canadian researchers Shannon Charlebois and Jasmine Power called it a crisis of communicable disease unfolding in North America. They described coordinated attacks on health institutions that have drastically reduced their capacity to protect public health. Here's the part that will blow your mind. While America dismantles its health infrastructure, Canada is moving in the opposite direction. At the October Federal Provincial Territorial Health Ministers meeting, all provinces agreed to put vaccination at the center of their communiqué. The statement was clear: vaccines save lives and healthcare cost. Ministers agreed to coordinate actions to build trust and respond to the current measles outbreak. But if America can't be trusted, where does Canada turn? Minister Mitchell says they must look to other like-minded countries. The issues with US misinformation are a big preoccupation. Some say this is a necessary break from unreliable information. Others warn it could fragment global health efforts. But here's the unanswered question. If the world's former health leader becomes a source of misinformation, what happens to countries like Kenya that rely on international guidance? The implications are massive. Vaccine hesitancy could spread. Measles outbreaks could worsen. Public trust in science could erode. The controversy is clear. Canada is drawing a line in the sand. America's health institutions are no longer reliable partners. The system that once led the world is now viewed with suspicion. Do you think countries should break health partnerships over vaccine misinformation? Drop your take in the comments. Subscribe to Kenya News Update today for more breaking international news that affects us all.